going to administer a bolus feed. So it's still going to be through NG tube, but I took the NG tube out of the patient because it is a mannequin and we don't need it getting wet in the inside. All right, so what you're going to need for this, you're going to need a irrigation set, and then you're going to need to fill it up with some water, and then you're going to need whatever type of nutrition is ordered for your patient. All right, so we want to make sure that we've already checked placement. So how do we check placement of the NG tube? We want to make sure that we have a chest x-ray. We also can check gastric contents and test the pH. But you guys, the biggest and the most important way, the for sure 100% way, is to make sure that you have a chest x-ray. But you're not going to get a chest x-ray every time that you give the patient a feed. So that's why you can check gastric contents. It is important that when your patient is receiving feeds that you make sure their head of the bed is at least at 30 degrees. Right, so what we're going to do first is we're going to flush our NG tube. So we know that we're going to flush with 30 mLs of water. So it's just important to flush your NG tube just to keep the patency of your tube good. So you're going to take this, you're going to connect it here, and you're just going to flush it. And you're going to wait until the flush is done. All right. So I always say that that is by force, right? But now we're going to do the rest by gravity. All right. So I'm just going to take this part off, and then I'm just going to connect it here. So we've already flushed our line with 30 mLs of water. Now, if you have an order that tells you to flush with 100 before, then that's what you do. But if it doesn't tell you, rule of thumb is just to flush with 30. So then you want to shake up your nutrition, because you guys, sometimes it could be thick and have little clumps in there. So you want to shake it up. So next, what you're going to do is you're just going to pour this in here. All right, and you're just going to allow it to flow. Now, one thing about an NG tube is it is through gravity. So, you know, you may have to lift it up. Now, this nutrition is kind of thick, so it may take a little while. So what you can do if your patient is not on any type of fluid restrictions, I could go and add a little water to it just to dilute it. But if your patient is on fluid restriction and every drop counts, then you don't want to do that. But it is slowly draining. I see it draining in the patient's stomach. So what you would just do if the order is to give that patient that whole can of food, then that's what we're gonna do, okay? So we're gonna allow it to flow. It's slowly going there. But you would have to do this for the entire amount. We're not going to do the entire amount for the sake of the video. So let's say that they say they're supposed to get this 1 can every 4 hours. You would do this every 4 hours. Now your order will say, give the patient a bolus of Premier protein, and after that, give them a 200 ml flush of water. So with the continuous, we don't have to flush our patient, right? The machine does all the work for us. But if your patient is getting bolus feeds, then we would have to manually give them the water. So after this finish, we would then fill this up, and we would do this until we would get 200 mLs of water. So this right here is 60. So we would have to do this a little over 3 times. So what we'll just do is we'll just let the water go down as well. So you guys, the biggest thing to know that when you have an NG tube is that it goes by gravity. So you see how the higher I'm moving it up, that, you know, it goes faster. But you want to make sure that you're careful, because when this is in the patient's nose, you don't want to be doing all that maneuvering and all that stuff like that. Flush the patient with 200 mLs of water, then you're good to go. So what you can do is you can see they have this little open little area right here. So some NG tube sets actually come with a little cap with the NG tube. So all you would just do is place this on here, and this can be used as a little stopper. So let's say that you wasn't using the NG tube, you could just put this little stopper right here on there. Or this is also what you could be using to hook your syringe up. So there's certain syringes that go on here, not the syringe that I have, but there's a certain syringe that could go on here that you can actually use it and give your medicines and all that. It just hooks up here.